concerned about this? How concerned are you? We're still in a summer season, but people are meeting other people.
I think it's concerning. It's good to see that the rate is slower than we've seen before, but this is definitely the beginning of a fourth wave. It's going to hit unvaccinated people a lot. I think for vaccinated folks, death from this thing is off the table. It's 1 in a million. But if you're unvaccinated, you really need to get in and get your shots as quickly as possible. You're basically out of time now.
How do you feel about that border, the reopening to fully vaccinated Americans?
I think, there's not much of a danger from fully vaccinated travelers. I would like to see some tightening, like having rapid testing. Like a device like this is a rapid test you could give to someone crossing the border in 15 minutes, especially for kids coming across the border who are unvaccinated, just to make sure that they're not infectious. The neighboring counties, like if you look at Erie and Niagara County on the U.S. side, they have lower case numbers than BC and Alberta right now. So really, we should be testing every arrival into Ontario on arrival at the whether it's from other provinces or other states or countries.
Well, you hit it on there. It's children, right? They're not approved yet to get a vaccine. Even kids here are not approved for the vaccine. So with the numbers in the U.S. and a lot of children now ending up in hospital, you mentioned rapid testing. I mean, should there be more of a restriction there as well?
Yeah, definitely. Like if you look carefully at the numbers, states that have low case numbers like New York, Massachusetts, have less kids going into hospital than states that are just letting the numbers go crazy like Arkansas, Florida. And that's what should be our goal is there's a fourth wave starting, keep the case numbers as low as possible. That's the best way to protect kids less than 12.
Okay, so you mentioned we're getting into a fourth wave here. What change do you foresee in the fall? I mean, if we are open and continue to be open across the country, meaning fewer restrictions, perhaps just a mask mandate, what is your concern for September?
I think, we have to realize I'm concerned if we don't take a combined approach. Like we've over-relied on vaccines so far, but vaccines are part of a solution, including masks, including rapid testing, including ventilation changes, like recognizing that this virus is airborne. If we don't do that, I feel like we're going to have a rapid acceleration like these U.S. states are having, and we're going to put the kids in danger. So we need to have a combined plan with all of these approaches.
Got it. Dr. Kashif Pirzada, I've got to leave the conversation there, but thank you for your time. Appreciate that.
Thank you. Stay safe.